Because the healthcare proxy just takes up where the patient who has now lost capacity has left off, many of the decisions faced by the healthcare proxy are the same ones that the patient has been discussing and deciding as she creates and implements her healthcare plan, her palliative care healthcare plan. So what kinds of decisions would these be? It might mean, where does the care take place? Does a person want to be in a long-term care facility or rehab, or does that person want to be at home getting home care? Does a person who has a chronic illness that's continually deteriorating want to go into the hospital over and over and over again? Or would she or he like to stay at home and get whatever care they can get there? What about resuscitation in the event of a cardiac or pulmonary arrest? If the heart stops or the breathing stops, do you want to be resuscitated? As people approach the end of their lives, many decide not to be resuscitated, but to let nature take its course, is the phrase you hear over and over and over again. You know, in Roman Catholic thought, we see our existence here on earth as kind of the second last stop. Our ultimate goal is to be in the presence of God for all eternity. And so while we reverence life and we have respect for the gift that our Creator has given us, the gift of life, and we do all that we can to take care of it and ourselves, there does come a time in our disease progress where we realize it is more likely than not that we're in what's called an active dying phase, and that we would probably not want resuscitation. People make decisions about dialysis, about surgery, about transfusions. There are a lot of healthcare interventions that are possible as a disease progresses, and those decisions are first made by the patient and then by the healthcare proxy when the patient loses capacity to speak for herself or himself. What's important for a healthcare proxy to know is the same thing that's important for the patient to know as these different decisions are presented. What are the benefits? What are the risks? What is the likely outcome? What does my value system teach? What are my preferences? What does this mean about my ongoing engagement with life and with my God? What does the church teach? There's a lot of work to do, a lot of homework to do, and there's a lot of discussion to be had with those people who inform you, who support you, and who care for you. My name is MC Sullivan. I'm Director for the Initiative on Palliative Care and Advanced Care Planning.